All right. Well, good morning, everyone, and Happy New Year. Hope everyone's staying safe, doing their due diligence during this pandemic time. Today's Medicare webinar is going to try to answer a lot of questions regarding Medicare and the transition from the non-Medicare grouping over to the Medicare side, and a lot of the little things that may come your way that can be kind of confusing at times. All the notifications and just a truckload of mail, junk mail that you're going to get, trying to get you to sign up with different types of plans and so forth. But you don't have to worry about all those, because since you're already enrolled in a plan with the Sarah, you just need to just follow through with the items that we forward to you, and we are here to assist you to transition into a Medicare plan. Okay. So we'll go ahead and start. Okay, so we've already done our introductions. You met Mike Farah, and I'm Ish Pina, Assistant Benefits Manager over the Healthcare Unit here at Acera. So we're going to provide you a Medicare overview of Medicare. We're going to talk about Acera's plans and the Medicare mandates, how Medicare works, and various Medicare plan types and options that you have. And then, of course, as Mike said, we'll be available for questions. So who's eligible for Medicare and who's involved? Okay, so typically it's people 65 or older, because when you get to be 65, you're eligible to enroll in Medicare. Okay, there are some members who are under 65 if they have some kind of disability, and they've been disabled for a certain period of time. Social Security can grant you your Medicare early, which is a good thing, because then you get to get onto a plan that's lower in costs. Okay, of course, anyone with ESRD or Lou Gehrig's disease, and basically Social Security Administration is the one that oversees the Medicare. And of course, the Center of Medicare and Medicaid Services, are the CMS. They're the ones that pretty much send you your card and things like that. Okay. Okay, so if you are currently receiving your Social Security check, okay, they say it's automatic, that they will go ahead and enroll you into Medicare upon your 65th birthday. But we always encourage members to just give Social Security a call. I would say, like within 90 days before, just go ahead and just give them a call. Say, hey, I'm going to be turning 65, and I just want to make sure you have all my information to begin the process to get my Medicare. And that's a good chance for them to go ahead and take a look and make sure they have everything current for you, and then they can go ahead and start the process and get you going on that. Okay, so otherwise they will send you a Medicare card, and so you want to make sure you always have your address is current, and that sometimes the Medicare card will arrive sometimes months in advance. There was a time where Medicare was pretty good at getting that out there during this time of pandemic and things like that. And of course, the post office is kind of a little bit slower now due to certain items that have been occurring. So it may take a little bit for them to get you your card, but they do try to get your card out to you as soon as they can. Okay. No, so yeah, some retirees or dependents who are disabled may be eligible for Medicare earlier than 65. I believe I mentioned that earlier. Okay. All right. So if you're not receiving a Social Security check, okay, so if you're not receiving a Social Security check and you're waiting to your older age so that benefit can be larger, then yeah, you want to make sure you reach out to Social Security and still get your Medicare started for when you turn 65. They will bill you quarterly, so they'll bill you for 3 months at a time for your Medicare premiums that you're required to pay, and so you are needing to go ahead and make sure that that gets paid, okay? Because otherwise they will disenroll you from Medicare if they don't get their payment. But if you're collecting a Social Security check, then they automatically will deduct it out of your Social Security check. And from what I understand from members who have gone through this process, they will send you a letter letting you know what your new amount will be for your Social Security check based on the deduction of that premium for the Part B. Okay, so you can always give Social Security a call at that number to obtain information and how to enroll and so forth, or you can go onto their website to enroll online also. Okay. So Acera's Medicare Mandate. Okay, so when you and your dependent become Medicare eligible, which normally at 65, in order to continue enrollment, you need to go ahead and transition over to a Medicare plan. And a little bit in a few slides, I'm going to show you why it is beneficial for you to do that, or for your dependents to do that. And it's mainly because the premiums are much lower on a Medicare plan. Okay, so we'll save you some money. Now I'll be going over that a little bit later during this presentation. Okay, so this mandate does all apply to retirees who are receiving the monthly medical allowance. So those items which are not guaranteed benefit, but those items will go ahead and get modified to adjust to the premium for the plan that you're enrolled in. And I'll show you those in some slides that are coming. So currently the carrier that Acera offers with the Medicare group plan is our Kaiser Senior Advantage. Okay, Kaiser offers that plan. If you don't want to be on a Kaiser, then you can contact Via Benefits and get enrolled into an individual Medicare plan that's nationwide. Okay, so we're now able to have members who are living in other states enroll into a plan through Via Benefits, and they're eligible now to go ahead and start receiving the appropriate subsidies that they should be able to receive. Okay.
And Ish, there is a question. The question
Yes.
is, I thought I did not need to enroll in Medicare as long as I had employer insurance without penalty.
That is correct. So there is a section I'll be talking about that when you're a little bit in a few slides, where if you are still currently employed under an employer and you're on an employer plan, then you don't have to necessarily take your Medicare at this time. Okay, because you're enrolled on an employer plan. So, but you do want to go ahead and let Medicare know that, hey, I'm still working, I'm on my employer's plan. That way they can go ahead and make note for that. So, and that also will allow you to not get penalized for not enrolling in the Medicare as soon as you are eligible at 65. But you do want to make sure that as soon as you're getting ready to stop working or lose that employer group plan, you want to reach out to Social Security as soon as possible to let them know, hey, I'm going to stop working. I'm going to lose my employer plan. That way they can go ahead and start the process to activate your Medicare. Okay. And of course, they do have a form at that time that they would send over to the employer that would verify that you were on that employer plan and when the loss of coverage occurred. That way they can go ahead and start your Medicare effective as soon as that coverage ends. So for example, if that coverage was ending January 31st, Medicare would want to start February 1st. Okay, so they do verify that information, and there's a form that they send out to the employer to have them complete that to confirm everything.
Great.
Okay, so Acera's Medicare Mandate, and here's a way that it shows you how you can save some money. In this example, we're going to use a member who only has 17 years of service. They're turning age 65 and they're Medicare eligible. Okay, so under this scenario, this member is on the Kaiser HMO. Okay, which during 2021 it was $810.72. The subsidy for someone with 17 years of service was $433.99. Leaving the out-of-pocket difference of the $376.73 to come out of their monthly retirement check. Okay, so when this same person gets their Medicare and they decide to join Kaiser Senior Advantage and the Medicare plan, then their premium becomes $382.21, and based on the years of service, we're going to go ahead and subsidize the $382.21. That leaves zero out of pocket to come out of their monthly benefit from Acera. Okay, so that's $376.73 that gets to stay in their net. Okay, so you see how you can save quite a bit of money by becoming Medicare eligible and going on to a Medicare plan. Okay, in addition to the premium, the copay also drops down, because right now the Kaiser HMO under 65, the copays are $15. On the Senior Advantage plan, the copays are only $10. Okay, so depending upon how many medications or how often you go to visit a doctor, you know, at $5 a pop, that adds up pretty quickly too. Okay.
And there are a couple more questions.
Sure.
The first is a follow-up question from the earlier question, and it's, will you be talking about the time frame to avoid the penalty?
Yes, we will be talking about that later on in this presentation.
Great. Second question, for those who enrolled in Medicare Senior Advantage, are there additional premiums? Is there an additional premium for enrollment in the Prescription Part D plan?
No, there is not. Prescription Part D Medicare is built into the Senior Advantage plan, so there is no additional premium that you have to pay to be on that plan to have the Medicare Part D with it. Now, there is something called an IRMA, okay, that I will be talking about a little bit later in a few slides, that Medicare will look at your income to determine what your premiums are supposed to be for Medicare, and they do charge this additional IRMA monthly medical adjustment premium, but I'll be covering that in a few slides.
Sounds good.
Okay, so what is Medicare Part A? Well, when you become eligible and enroll in Medicare, Part A is the part that takes care of hospital insurance portion, okay? It helps to pay for hospital stays, skilled nursing facilities, rehabilitation, long-term care, hospice, things like that. So that's what Part A pretty much covers, okay? Enrolling in the Medicare Part A, okay, so if you've put in your quarters, which is typically the 40 quarters, the Medicare Part A is free. There's no premium for it. If you did not complete 40 quarters of employment and paying into the system over the years, then what they do is they do charge a premium for the Part A. Okay, so as you can see, if you 30 to 39 quarters completed, then they charge $259 a month. And if you didn't at all, then they charge a full $471 a month for the Part A. Okay, so for 2021, some members who didn't qualify, they would have had to have paid $471 to buy the Part A. Okay, so you want to make sure when you contact Social Security, when you talk about it, they will let you know whether or not you have to pay for Part A or not. Okay, if SSA says that you need to pay for Part A, then you want to reach out to us, Sarah, and talk to us about that. Okay, because we can kind of explain certain things for you regarding that. Okay, basically, if you're going into Kaiser, the Senior Advantage Plan, we do have a contract with Kaiser for a Part B only plan. Okay, so that you don't have to enroll in the Part A and pay that premium. Okay, we have a Part B only plan. But if you're able to get the A for free, then you want to make sure you go ahead and get that. That way you can have A and B with your Medicare plan. Okay, so again, there is a Part A late enrollment penalty if you wait beyond your 65th, and I'll be talking about the period in which you need to make sure you contact Social Security to get your Medicare in just a few slides. Okay, so but yeah, you don't want to have to pay a higher premium for twice the number of years that you could have had it. Okay, because they'll charge you the premium higher and for twice the amount of time that you did not enroll. Okay, so yeah, you want to make sure we're following the guidelines and signing up when you can. All right, so what is Medicare Part B? Medicare Part B provides the medical insurance portion. It pays for approved doctor services, outpatient care, preventive care services, diagnostic tests, a whole bunch of stuff under the Part B, okay? So they may have sent you, if they have not done so, you can always go to their Medicare website and download it. It's a Medicare and You booklet. They renew it every year, and in there it has a whole list of stuff that's covered and what they, the portions and anything like that covers for Medicare that you would be able to get services for and so forth. Okay, so it's called Medicare and You. So for most Medicare eligible individuals, the monthly premium in 2021 was $148.50. Okay, which is the lowest standard Medicare Part B premium amount. Okay, so this year for 2022, okay, that base amount of the 148.50 is now 170.10. So $170.10 is the base amount. Okay, and that will, like I said, that would be deducted out of your Social Security check. Otherwise, they bill you quarterly. Okay, so we have many preventive care and supplies and so forth are taken care of. So you want to make sure that you're checking in to make sure that everything is all good. Okay. Next slide. Okay. So enrolling in Medicare Parts A and B Okay, so you can go online to Social Security to do it. You can give them a call. I have here that you visit your local office. They may or may not have opened up. You know how places open up and then they close back up again due to this pandemic stuff. But it's probably easier just to go ahead and just do it over the phone. You can give them a call. They can set something up for you. You can fill out the application for enrollment in Medicare Part B, and you want to make sure you submit it. I'm not sure. Well, again, I'm not sure if they're still open. Most offices do allow drop-offs, but you can submit it back to Social Security so they can go ahead and get that taken care of for you. Okay. Again, completing the application form and submitting it does not automatically enroll you in Medicare Part B. Social Security must first determine that you're eligible, and then they'll go ahead and enroll you. Okay. Okay, so enrolling in Medicare Part B at the right time is critical. Okay, so basically you have a 7-month enrollment period. You have 3 months before the month of your 65th birthday, okay, effective the first day of the birthday month, the month of birth, okay, and then 3 months after your 65th birthday. So Medicare becomes effective the first of whatever month you're born in, unless you're born on the first of the month. So if your birthday, for example, was on April 1st, which is April Fool's Day, okay, then your Medicare would be effective March 1st, okay? If your birthday was, let's say, April 2nd, then your Medicare is effective April 1st. It's always effective the first of the month in which you turn 65, unless your birthday falls on the first of the month. So for example, if your birthday is in April, okay, 3 months before is January. You got January, February, March. That's 3 months before your 65th birthday month. Okay. And then you have all the way to July, because you're born in April, then you got May, June, July. So you have 3 months after. You should have all the way into July to apply to get your Medicare. Anything beyond that, then they will charge you this penalty. Okay. They will charge you a penalty, and it starts to build up and add up. So you don't want to delay in enrolling to get your Medicare. Okay, you or your dependent, whoever's eligible for the Medicare. Okay. Again, if you miss the enrollment period, okay, they do have January through March each year, but the coverage for the Medicare, they'll make it effective July of that year. Okay, and so if you, as in the previous slide that showed the Kaiser premium, that 376 amount that was coming out, which is the net out of pocket, that means you're still going to pay that amount all the way into your Medicare, because it's effective in July. And you don't want to have to, pay that extra amount. You want to be able to save money as soon as you can, right? So there is a lifetime 10% penalty for each 12-month period that you did not enroll in Part B. Okay, so the exception is the working aged. This is the members who are still actively working and on an employer plan, or they're under their spouse's employer's plan. Okay, you just gotta make sure you let them know that, hey, I'm still covered under the plan. Okay, you could delay your enrollment in Part B until you come off that plan. But you got to make sure you retain credible coverage until that happens. So that way you can enroll without having to pay any kind of penalty. Okay.
Okay, we have 3 questions up on the board. The first one is, the retirement application requires providing the Medicare Part B card number. So I went online to sign up for Part A and Part B. Do I need to wait for my card to submit my retirement application?
No, you don't have to wait for your Medicare information to submit your application. You want to go ahead and submit your application. It may take a little bit for Medicare to go ahead and process your application for Medicare and then send you your actual card. So you don't want to delay your retirement stuff. You can still get that into us as soon as you receive it.
Great. And then the second question is, how is enrollment affected if you did not enroll at 65 since you were working?
Well, becoming Medicare eligible is a qualifying event. Okay, so at that time, you're able to go ahead and enroll into a plan, because becoming Medicare eligible is a qualifying event. Okay.
But so I think the question is, they were working and they turned 65 while they were working, and then I guess they're going to retire, um, is enrollment affected at all because of that? Because you turned 65 while you're working?
No, enrollment's not impacted. You're still covered under your employer's plan. So, and we happen to have lots of retirees who, they work beyond 65. They finally retire. Now they decide to retire. They're already beyond 65. So now they're losing the employer coverage, okay, which in itself is a qualifying event, and becoming Medicare eligible. So you're going to stop working on them working, you're going to lose your employer plan. You're coming over to Acera as a retiree. You're now qualified to enroll in our plan. The employer plan, we'll be looking to see, okay, when is that one going to end? Let's say that's going to end, let's say April 30th. Okay, then you come onto Acera's plan as of May 1st, so that there's no lapse in coverage. And it also allows you to notify Medicare that, hey, I'm coming off my employer plan as of April 30th, because I'm going to be retiring. And then they can go ahead and grant you your Medicare for May 1st. That way there's no gap.
Okay. And so that kind of answers the follow-up question. They were asking, I guess, what's the time period allowed to enroll in that situation? But it sounds like what you want to do is line it up so that you're enrolling so that you get right into the Medicare plan on your first day of retirement and you go right into that plan with no gap. Is that right?
Right. Your coverage would just roll right over so that you don't have a gap in coverage. Now, depending upon the timing of everything, you may be placed, you may come over, retire, and let's say you are selecting Kaiser. We may have to we will put you on the Kaiser HMO, which is a higher premium plan. And then while your Medicare is being processed and approved. Now, once Medicare does the approval, and then they report that to Kaiser, letting then Kaiser know, yes, we approve this. This is going to be effective as of such and such day. Kaiser lets us know, they report that to us. And then what we do is our team will go in and they will adjust the premium. So basically they back out all the higher HMO premium and they adjust it and put in the skips a lower premium. So you may get some reimbursements of some of those out-of-pocket premiums that you ended up paying. But that's normal because sometimes it does take a little while for Medicare to review and give the approval. So, but once we get that approval and it does go all the way back, then we will go ahead and refund and adjust those premiums back to you, giving back the money.
Okay. And so this is kind of a follow-up question regarding the timing around all that stuff, by a different person. They're saying, if I'm planning to retire right after I turn 65, so I guess they're turning 65 while they're working, do I contact Social Security Administration 3 months earlier and then delay my retirement for a few months, or what do I need to do?
No, if you're already past 65 and they already know that you're set for Medicare, they're just waiting for you to let them know, well, when do you need it to start? So you don't have to delay your retirement and so forth. You can still just let them know. If you know the date, let's say you're going to go ahead and retire in April, okay, and you're going to go ahead and your employer says, okay, we're still going to cover you through the end of May, because the 2 checks that you get 1 month pays for the next month's coverage. So you retired towards the end of April. Those there's 3 checks in April this current year, but the first 2 checks is already paying for May. So then, of course, you're going to lose your employer coverage May 31st. So you want to let the Medicare know that, or Social Security know that, hey, I'm going to lose coverage as of May 31st. I need my Medicare for June 1st, and then they'll go ahead and just put it in for the June 1st and get you all taken care of. Mm-hmm.
Great. And one more question that's up there. Since I'm still working, will it be a problem that I didn't enroll previously or notify Social Security Administration?
No, it's not a problem. Because eventually when you do stop working and you're going to lose the employer plan and you apply for your Medicare, they're going to send that form. It's a verification form to the employer requesting the verification that you were enrolled into their plan and when was the last day of coverage that you had with them, so that they basically the employer is going to be reviewing it. They mark the proper boxes and they're signing it off, stating, yes, this person did have coverage with us and this was the last date of their coverage. And then when they send it back and the Social Security say, okay, yeah, they did have coverage and they lost the coverage on such and such day. So now we can go ahead and start their Medicare as of that very next day, so that there's no gap.
Great. Okay.
Okay. All right. Again, so employer plans. So basically your options are you could delay your Part B enrollment and only use your employer plan, which is ideal, right? Because employer plans pretty basically they pay 100%. You just got to pay your copay. Okay. You can enroll in Part A and B and have both Medicare and the employer coverage. There's likely no benefit to that because Medicare is only going to say, okay, well, thank you for paying your premium to us, but we're not going to pay for any claims that comes our way. But thanks for the extra money. That's of course who wants to do that. Okay. Or of course, the one that of course nobody wants to ever do this is reject your employer plan and just enroll in Medicare and then supplement other ways. That's not a smart move. We don't want to do that. So the best thing to do is go ahead, just delay the Part B until you and use your employer plan. And when you come off your employer plan, as you're going to come off, you're going to let the Social Security know, hey, I'm going to lose my employer plan because now I'm going to stop working. That way they can go ahead and activate your Medicare, and you'd be filling out the forms to enroll into a plan with us. Okay. Okay. So basically this is there's a chart for the Medicare Part B. Okay, everybody pays Part B. Okay, it's just a matter of how much. So for example, what they do is they have their own criteria, and what they do is they'll do a 2-year look back. Okay, so in this particular chart, which was for 2021, they would have looked back at 2019. We're now in 2022, so they're looking back at 2020. So they're going to look at your 2020 tax return to see what you submitted in. Okay, now depending upon where you fall, as you can see, you file individual tax return at the very top. Okay, the top left box, $88,000 or less. You slide across and you see your Part B premium would have been $148.50. Okay, if you file a joint tax return and it was $176,000 or less, your Medicare Part B premium is $148.50. Okay, if you're file individual and you're above $138,000 up to $165,000, you slide across, your Medicare Part B premium was going to be $386.10. Okay, so remember, they're going to do a 2-year look back. So all of you now here in 2022, they're going to be looking at your 2020 tax returns. Okay, so and in 2021, it was $148.50. Here in 2022, the new base amount is $170.10. $170.10 is the base amount. Okay, and that premium, you do have to pay that to Medicare. Okay, so you have your Medicare, your Medicare plan premiums here out of SARA coming out of your monthly benefit. Okay, and we're subsidizing towards that, but you still need to pay your Part B premium to have the Medicare Part B to Medicare. Okay. Okay.
There are a couple of questions. So one question is this AGI any adjustment for head of household? I'm not sure what AGI stands for, but is there any adjustment for head of household?
I'm not sure about head of house. I just know that they're looking at your adjusted gross income. So whatever it is that's on your tax return, that's what they're looking at. I don't know if they're looking at head of household or however it is, but they're looking at what your adjusted gross income is on that tax return. To know this more specifics as far as what box, what figure they're actually looking at, or if they have any other considerations on their criteria, you'd have to reach out to Social Security to find out what their criteria is.
Okay. Oh, and AGI means adjusted gross income.
Yes,
So
adjusted gross income.
So this is adjusted gross income. Okay. And I found the premiums for 2022 and the
cool.
Different tier amounts.
Cool. Thanks, Mike. So right there in the top box, you see for 2022, individual less than or equal to 91,000, you're going to be paying $170.10 for your Part B premium. If you file joint and you're less than or equal to 182,000, then your Medicare Part B premium is $170.10. And then going for down, greater than 142,000 and less than or equal to 170,000, then your Part B premium is 442.30. Okay.
Great. And then there was a question, so this premium resets every year, and the answer would be yes, because these are the premiums for the new year.
Yes, these are adjusted every year. And there are times where someone will be in a look at and be in a higher bracket. For example, some members they sell property, or they took a big chunk out of a deferred comp or an IRA account or something like that. And so for that particular year, their income looks like it's much higher, but that's not what their true income is because they sold some property or they took out a bunch of money from an IRA or something like that. So, but what's on the tax return is what's on the tax return. And so that's what they're going to base your premium off of. But you can always reach out to them, talk to them about that. But they will review every year, and then they'll see, oh yeah, that year was just a bump up because they did, this and this and this. So then they'll go ahead and they'll adjust and reduce down your premium. They do review every year. Okay.
Great.
Mm-hmm. Okay, so now, not to fear though, because Sarah, we do have a program for you retiree members. I'm sorry, dependents, it's not for dependents, it's only for the retiree members, but it's called the Medicare Part B Reimbursement Plan, MBRP. And basically this plan, as long as you complete the form, okay, and it's a real simple form. I tried to make it real difficult. It's your name and address, you mark the box that you have your Medicare, and you sign the form. That's about as difficult as it gets. And then you just supply a copy of your Medicare card that shows that you have Part B, and you send it into a Sarah. Now on your monthly benefit, on the, let's see here, I'm trying to visualize what you guys' statements look like. Okay, so on the left side, top box, that's where you see base amount. And below that, you normally see, that's where you see your cost of living adjustment that's granted to you, right? Well, below that, you'll see a new line that says Medicare Part B Reimbursement Plan, and you'll see this for this year, 170.10 on your benefits. So we're going to give you an additional 170.10. Okay, so basically, you're paying Medicare the 170.10 to have your Part B. Okay, but in your pocket here at Sarah, we're giving you 170.10. Okay, so it's a wash. And for this year, the board did approve this for 170.10. That is the base amount, and that's all we reimburse towards. So if for whatever reason you have a Medicare Part B premium that's higher, let's say they're charging you 210, okay, well, you still have to pay that 210 to Medicare, but in your monthly retirement benefit, we're going to be giving you 170.10. So it's not that bad of a break. It's not, you're getting most of it back. We're giving you back the 170.10. Okay, this is a non-vested benefit. Okay, it's not available for dependents, and it's not going to reimburse any dependent costs. To be on this plan, to qualify for this, you have to have at least 10 years of service with the Sarah, okay, or have a service-connected disability. You have to provide us proof that you have the Medicare Part B. Okay, so basically you send us a copy of the card with the form. Okay, and you want to enroll in the Medicare Part B as soon as you become, eligible for the Medicare. That way we're not, you're not missing out a month. You became Medicare eligible now in February, and yet you wait till June or something like that because you may have forgotten to send in the form. So then you send us the form and the Medicare card in June. Okay, we're not going to go retro back to February. It's not a retroactive benefit. So we start it when we get the form and the card. Okay, depending upon the effective date of your benefit. We're not going to go retro back. So you got to make sure you're watching that and get that into us as soon as possible. That way we can go ahead and get you all set up for that. Now, you do not have to be enrolled in an ASERA plan to get this. Okay, this is a years of service benefit. It's not a medical benefit. So let's say you're not enrolled in a ASERA plan because you're enrolled in a plan with your another agency, or another employer or under your spouse's plan or something like that, under your dependent's plan, you're enrolled in their plan. So you're not even on a Nasera plan. That's fine. It's a years of service benefit. As long as you meet the criteria here, 10 years or more, you got the Part B, you give us a copy of the form, copy of the Medicare card, we can go ahead and activate the reimbursement here for you. Okay. Enrollment is not automatic. Simply because you became Medicare eligible, it doesn't mean we're going to automatically start granting you this one additional monies. Okay. You must complete the form and provide us proof that you have the Part B for us to go ahead and review and activate this credit onto your monthly benefit. Okay. Again, enrollment in a Nasera medical plan is not required. Okay. All right. So here we go with the Part D premiums. Again, similar to the Part B, they do look and they'll go ahead and charge you accordingly. It's almost like getting penalized. To me, it's when they first started this several years ago, to me, it's kind of like being penalized for having a nice retirement or income, So basically, they're going to do a 2-year look back and they see, okay, for file individual, look at that, 88,000. Okay, it's basically the same chart that the Part B premiums use. For 88,000 or less, you're going to just pay your Medicare premium, the Part D premium. But you don't. If you're on our Senior Advantage plan, you don't have a premium because it's already built into the KIPSA plan, Kaiser Senior Advantage premium that we're already deducting. Okay. Oh, here's the 22 too. Thanks, Mike. Okay, so for 2022, you got 91,000 or less. You just have your premium, your plan premium. Going down to the third one, above 114,000 and up to 142,000. Then if you slide across, you see it says $32.10. Okay, so basically your IRMA is going to be $32.10. So this is not a premium for your Part D as in prescription. Okay, this is just an extra adjustment that Medicare charges because you have a decent income that you're reporting. It's to me, it's like being penalized is what I believe it is, But anyway, it's a way that they can try to earn extra money for their organization, and programs and stuff like that. So basically, the higher your income is, the higher your IRMA is going to be. And they do expect you to pay this adjustment. If you don't pay it, then what they do is they turn around and they disenroll you from your Medicare, which causes a whole bunch of other troubles, and you don't want to go through that. Unfortunately, we do not reimburse anything towards this. Sarah does not have a program that we reimburse towards this. So this is just something in addition that you would have to pay, make sure you pay to Medicare for. Okay, it's called the IRMA. Okay.
And there's a question.
Yes.
I will start Medicare Part B in April. Can I send in the application for the Medicare Part B reimbursement plan now?
Sure. Yeah. If you can send it in ahead of time, that's great. That's you're encouraged to do so. The sooner you get your proof that you're eligible, and you get your card and you fill out that form, make a copy of that card, you get that into us so that we can get you all set up. Okay.
Okay.
All right. Okay. So the types of Medicare plans, and this is where a lot of people seem to get a little confused. And so I'm going to take a little moment here to try and clarify. Okay. So there's 2 types of plans. Okay. You have your Medicare Advantage plan, as you can see right there to the left, the gold one. Okay. And basically that's similar to your HMO plan. Okay. Your Medicare is assigned to that selected carrier. Okay. Medical group. You have a primary doctor that you select. Okay. You must get your primary doctor to provide your referral to go see a specialist. Yeah, everybody's all used to that, right? Most Medicare Advantage plans have prescription Part D built into it as part of its plan. So you don't have to turn around and enroll into a Medicare Part D prescription plan elsewhere to try to cover prescriptions. And you don't want to do that, because if you did that, then what happens is your Medicare gets assigned to that other plan and disengage from your medical plan, right? And then what happens is the medical, they've disenrolled, and then they drop you from the plan. So you do not want to start signing up for some of these other prescription drug plans outside of what your plan has. Okay. You don't want to do that. Trust me. Okay. I mean, I know we get a lot that you see a lot of commercials and stuff like that. Oh, sign up for this, your prescription's only $2 and this, we'll give you a duffel bag and everything. No, forget the duffel bag. Just stick with your plan. It has the prescription Part D already built into it. Stay on track, team. Stay on track. Okay. And then typically they do have copays. Your Medicare Advantage plans, they don't have a copay that may vary. Okay. And you must reside in the plan service area. So if you're in a Medicare Advantage plan, typically they have certain zip code areas. Okay. So you have to reside within that zip code of their service area. Okay. So for example, you can't just be, for example, in a Medicare Advantage plan, let's say, for example, our Kaiser Senior Advantage plan, and and it's here in California only. And then you go visit relatives in Miami. And while you're out there on vacation, you say, you know what, I think I'll go get a checkup and try to go get a checkup at a doctor or something like that. They're not going to cover that. Okay. Whenever you're traveling anywhere, when you're on any kind of medical plan, they always have emergency services. Okay. They understand people aren't stationary. Vast majority of people aren't stationary. You're going to travel here and there. And so emergency services is you're on vacation somewhere, you get sick, you get injured, you can go get services. Okay. So, but you can't go get just a routine checkups and things like that. You can't do that. Okay. Now, on a medigap plan, that's over to the right. The medigap plan, or so-called supplemental plan, Medicare is not assigned and selected to the carrier medical group. Okay. You do not have a primary doctor. You may have a doctor that you love, you like your doctor, that's when you always go to, but that's not your primary doctor when you're on a medigap or supplemental plan. Okay. It's not assigned as your primary doctor. You can go see any doctor that accepts Medicare nationwide. So let's say you're on a medigap plan, supplement plan, and you're here in California. And then all of a sudden you say, oh, let's go check out the new, Statue of Liberty. And you're going to visit a Statue of Liberty, shopping around New York, and all of a sudden you injured yourself, you twisted your ankle, something going up the steps or whatever the case is, and you got to go see a doctor. You can go ahead and do that, not a problem. Okay. Let's say you go visit relatives in another state somewhere and you're staying there for a while because the weather's great, you're visiting and having fun and stuff like that, and you say, hey, maybe I'll go get a checkup. I have this little feeling down here in my side, I'm going to go get it checked out. You can go ahead and do that, not a problem. It's not an emergency services only, because this medigap supplement is nationwide. You can go see any doctor, any specialist that takes Medicare, period. You do not need a referral to see a specialist. If that specialist takes Medicare nationwide, you can go ahead and go see that specialist. You can be here in California and the doctor says, hey, this is happening to you, and we need to do this procedure. Okay. You can call, and that the specialist of the nation is in another state somewhere. You can contact, and they take Medicare. You can contact them and say, hey, you take Medicare, right? They say, yes. You can go and make an appointment and travel over there to see the nation's best, and use your Medicare to take care of that appointment. Okay. It's nationwide. As long as they take Medicare, you can go see any specialist. You don't need a referral. Okay. Again, these are medical only. The medigap and supplemental plans are medical only. They do not have a prescription component. Okay. So basically, Medicare covers 80%. Medigap supplement plans, they pick up the other 20. And that's how you got the 100%. So when you enroll into one of these, you will need to enroll in a prescription drug plan for the Part D. Okay. Now, copays and deductibles, they may vary depending upon the plan type selected, because there's several different versions of the medigap plans. You may have heard like Plan G, Plan F, Plan L, Plan M. They have different levels of the medigap plans. Okay. And so some carriers may have a low premium, but then they'll have a deductible along with it. Others have a decent premium for and copay, and no deductibles. So you got to take a look at what is involved in the medigap plan that you're enrolling into. Okay. Back in the day when we used to have a medigap plan, It used to be called the Senior Supplement Plan from United Healthcare. When we disengaged that contract and went over to Via Benefits, okay, the plan that we had was a Plan F as in Frank. Okay, that was the most comprehensive of the medigap plans. Okay, so about 2 years ago or so forth, there was some change with the government and so forth, and they kind of modified certain things, and so Plan F's pretty much went away. So if you were enrolled in a Plan F, then you got grandfathered, you could stay in it. But once you got off of it, then you couldn't go back in it because they were no longer going to accept enrollment. Now, the plan that it was equivalent to that was I believe it was a Plan G, as in good. Okay, so a Plan G is, again, one of the most comprehensive of the medigap plans. Okay, so there's still some pretty good, they're all pretty good. You just got to be aware of what the premiums are and so forth, because some carriers would try to charge you a little bit more than others, and it's the exact same coverage. It's the exact same coverage. Why they charge you a little bit more? Because they choose to do so, because people are going to pay it. So do your homework, do some comparison, and you should be fine. Okay. And the medigap plans, if you're looking to go that route, if you're not going to our Kaiser with Via Benefits, the benefits advisors over there, they do have some that are licensed and special to be able to go through these and pretty much explain them to you so that you can select a good plan for yourself. Okay. And that's for both the Medicare Advantage and the medigap plans. Via Benefits can get you enrolled in either one of those. You just got to let them know which one you want to go with and what you're looking for. Okay. Again, the medigap supplement plans, United States is the service area. So it's nationwide. Okay. Wherever Medicare goes, it goes. Okay.
Okay. We got a bunch of questions up on the board.
All right.
Okay.
Questions.
So first one, if I understand the look back for 2 years, this means that after I retire and my income takes a big drop, I will be charged for the next 2 years based on my working income?
No. You don't get charged for the next 2 years. The premiums change every year. Okay. It's just that for that particular year that you're getting in, they're looking back 2 years, a 2-year look back. So like, for example, right now we're in 2022. So they're going to do a 2-year look back. Now that they're trying to enroll you, they're going to look at your 2020, okay, 2 years back. Once you're in, you're in. So then every year, now that you're in, every year, they're always going to do a review, okay, and go ahead and just modify the premium. They modify the premium, okay. Every year seems to usually goes up. It's rarely that it ever goes down. There has been times where it did, but every year it bumps up a little bit. Okay. So if you're, like I said, if you sold some property or you pulled money out of deferred comp and so forth, this particular year, it looks like your income was high. Okay. Well, next year when they start to do their review again, which is like November, December, to start see what they're going to charge you for 2023, they're going to see that, their income is much lower. And so chances are they're going to go ahead and reduce down your premium, what they're charging you, because you don't have that high income anymore. Okay, that was just that 1 year bump up that occurred.
But Ish, what about in your first year that you're retired? Because you just went into retirement, and for the past 2 years you had a higher working income. Is your premium that first year going to be based on your higher working income over the past 2 years?
They're going to look, well, every like I said, every year when they're going to put you on, they're going to start by looking back 2 years. So they're going to look at 2020.
So they are going to do that for your,
they're going to look at 2020.
Working income.
You're just not coming on this year to get Medicare. They're going to look at your 2020. Now, at the end of 2022, this year, like around November, December, when the time comes, they'll take a look back and see, okay, what do they do in 2021? Oh, I see, it's much lower. Okay. So then for January 2023, they'll reduce down your premium. Okay, because they've taken a look at your 2021 and they see, okay, their income level down lower. So we can go ahead and lower their premium, and they'll lower it down.
Okay. Because they have to, they have to set your premium somewhere, and they have to base it on your income. And so your first year of retirement, the only income on record is, your working income. So that's what they're going to base it on. for the first.
Exactly.
Yeah. Okay.
Exactly.
Okay. Next question. If you have Kaiser Senior Advantage, do you need a Medigap plan?
No, you do not. Kaiser Senior Advantage. Okay. Everybody knows that Kaiser Senior Advantage, Kaiser. It's like its own little castle. Okay. So it's a one-stop shop. They got everything there for you. You know, you don't have to go out somewhere to a labs, Quest Labs or anything like that. Labs, they have it there. You don't have to go out to some kind of radiology clinic or anything. No, everything's right there in Kaiser. They got everything there. So you don't need to have, this other plan in addition to Kaiser.
Because it's already
Medicare can only have one plan in their system. Okay, so your Medicare is either going to be assigned to Kaiser if you're on the Kaiser Senior Advantage, or it's going to be assigned to this other medigap plan that you're trying to enroll into. If you have Kaiser Senior Advantage and you try to enroll into a medigap plan to help cover, okay, not that there's anything to cover, because Medicare with Kaiser Senior Advantage, you pay your copay, and that's it. You're done. There is nothing else. Kaiser takes care of everything else. But if you're in Senior Advantage with Kaiser, and then you enroll into this Medigap plan or something like that, another plan, Medicare is going to take the most recent application. So you signed up to this other Medigap plan. They're going to disengage your Medicare from the Kaiser Senior Advantage and assign it to that other plan. And notify Kaiser, hey, we've taken away the Medicare from you. They got into another plan. And then Kaiser's going to say, oh, they disenrolled from us. And then they're going to try to terminate the plan. So you're going to lose your Kaiser. So you can only have one plan. Medicare can only have one plan in their system. So your Medicare is assigned to one plan.
And the Kaiser Senior Advantage is a Medicare Advantage plan, hence the word Advantage, right?
Yes, it's a Medicare Advantage plan, and it has everything in it. Our Kaiser Senior Advantage plan has the prescription Part D built in. It has a prescription part of it. Your copays are $10 for office visits and $10 for your prescriptions.
Great. Okay, next question. If you are a snowbird, which is you spend part of the year here, part of the year, somewhere warm. Will I be covered by my Kaiser Advantage while I'm in my winter paradise? Or is it only emergency services?
Okay, so the Kaiser that we have is only California. Okay. Yes, I know that there's Kaiser in Hawaii, there's Kaiser in Oregon, Washington, Georgia, Atlanta, stuff like that. So, but your Kaiser with us is here in California. So if you go outside of California, okay, then you're only eligible for emergency services. Okay. So
also you have to, in order to enroll in that plan, the standard is that you have to live in the service area for 6 months out of the year. Is that correct?
That is correct. That's correct. If you stay beyond 6 months, then basically you're going to lose your eligibility to be enrolled in that plan. Okay. So, for most of my snowbirds, vast majority of my snowbirds, retirees, they go to that medigap plan. That way it doesn't matter where they are or how long they decide to stay there. They're covered wherever they want to go.
Right. Okay. And so on that point, like if you live in the California service area for 6 months, but then you spend 6 months of the winter in Florida, for example, if you're in Florida, you're not going to checkups, you're not going to the doctor for like that kind of stuff. It's just if there's urgent care or an emergency, right?
That is correct.
Yeah. Okay. Next question. Are the premiums for Part B and the premium for Medicare Senior Advantage billed separately?
Well, we don't talk with Social Security or Medicare. They won't even, if you had an issue with them and you reached out to us and we try to jump on a conference call, they will not talk to us. They will only talk to you, the enrollee. Okay. They won't talk to you if I'm on the line with you to try to help assist you through what's going on. So they're totally separate. They're going to bill you for what they need to bill you. Okay. We don't communicate with them. They don't communicate with us. And then what we have here at Acera, you're on our Senior Advantage plan. Okay. Then of course we're going to bill you accordingly on your benefit amount and subsidize accordingly. We're going to reimburse the MBRP for you and so forth. We handle our side. We do not communicate with Social Security or Medicare. They won't communicate with us. So whatever it is that Medicare is saying that you have to pay them for your premium for your your Medicare, you need to make sure that you pay that to them. Okay. On your Acera side, we're just activating that MBRP reimbursement to grant you that 170.10 as long as you provided us the form and the copy of the card.
And then this for the Senior Advantage plan, we're like basically billing. Acera is billing the member, but we're taking the premium automatically out of the check for the Kaiser plan at least.
Right, like
Right.
in that slide where for the Senior Advantage, it was this year actually. It's the last year was at 386 for the Medicare Senior Advantage. This year it actually went down. It's actually 344.44, and we're subsidizing that 344.44. So basically, it's zero cost to you. Okay, unless you have like under 10 years of service, then yeah, you still pay the full premium. Under 15 years of service, you still pay part of it as far as your premium for your Medicare plan on the Senior Advantage. So if someone who has only 10 years of service, let's say you have 10 years of service, the Kaiser Senior Advantage 344.44. We're going to subsidize 298.37. So the Kaiser Senior Advantage would cost you $46.07 a month. That's the net difference. We deduct it out of your retirement check, and then we put a credit in of that subsidy right in. So so the net difference is the only thing that you see coming out of your monthly benefit. Okay. If you have 15 years or more of service and you jump on a Senior Advantage plan with us, we're covering the entire 344. So there's zero cost to you for that plan.
Okay. Last question on the board currently is I applied for Social Security in January. I turned 65 in March. What if there is a delay in receiving my Medicare card? Will I still be penalized?
No, you're not penalized. As long as you apply to them, then what will happen is you still want to go and let's say you apply to them and you want to get into our Kaiser Senior Advantage plan. Okay. You still want to complete the Kaiser Senior Advantage plan with us. Okay, and send that into us so we can forward that to Kaiser because we have a specific Kaiser team, and it's an escalations team that handles our retiree members. Yes, they have a customer service team, and you can call the customer service number and talk to somebody, but they won't necessarily know what's going on with our particular members and where things are in the process with our escalations team because they're at a much higher level. Okay, so basically, you want to submit the Kaiser Senior Advantage form to us, Sarah. We process it. We get it over to our team at Kaiser that handles our members, and they go ahead. Their Medicare unit is able to access the Medicare database, and what they'll do is they'll see that your Medicare is pending. It's in a pending status with Medicare. Okay, so then you're already in the works. It's just a matter of Medicare giving the approval and the effective date, and then Kaiser can say, okay, cool. They approved it for this particular date. Boom, let's go ahead and start them on that. And then they report that to us. And then we know, oh, okay, so good. They finally approved it for that date. Okay, so now we can go back. Our team here at Sarah can go back and change those HMO premium deductions that we were taking out from you, okay, to Kaiser Senior's Advantage premium, which is lower, and then reimburse you some of the monies that you should have gotten kept, but because of the delay in Medicare's approval, we couldn't change it over from the HMO down to the Senior Advantage plan. So you don't want to. They may have a delay, but don't let them be the ones on the delay. You want to make sure you submit your enrollment forms to us early and soon because Medicare, they don't do retro. So for example, your birthday is in March. If you waited until inside of March or even April to send us the Medicare Senior Advantage plan form, they're not going to go retro back to March. They'll probably give you an approval for May. Okay, so if you're going to Senior Advantage, you want to supply us the Senior Advantage enrollment form before the month in which you turn 65. Okay, that way everything can get started and the approval process can get rolling, and that way we can get the approval back. Medicare can approve it and notify Kaiser. They can notify us, giving us time to get into our system and change the system to the deduction that should occur. Remember, we close payroll. We pay you guys at the end of the month for the month, and payroll freezes at the middle of the month. So if you supplied us your senior advantage form after a certain time of the month, and it's approved, we can't go in and modify the system to change the deduction. It's going to have to be delayed another month because we can't go in and change it when the system's frozen. Okay, it's closed for the month. So the sooner you supply us the Medicare form for enrolling, the sooner we can go ahead and forward it to Kaiser. They can notify Medicare and get them to start moving the ball to give the approval date. Okay, so the sooner the better.
Great. They say thank you.
Alrighty, so these are the plans that Acera offers. Okay, so we have for the non-Medicare, we have Kaiser HMO, we have United Healthcare Signature Value HMO, we have United Healthcare Signature Value Advantage, which is also an HMO. Okay, now when you become Medicare eligible, then you have Kaiser Senior Advantage. Okay, and if you don't want one of that plan, then you would notify via benefits, and they can assist you to find a Medicare plan of your liking that's nationwide. Now, the Kaiser Senior Advantage plan, again, okay, this is the 2021. However, the premiums for Kaiser Senior Advantage.
Let me bring up the, I'll bring up the 2022 ones. Let's see. Here is.
All right, here we go.
Guide.
Okay. So Kaiser Senior Advantage, okay, single party is $344.44. Okay. If you and your dependent both have Medicare, then it's $344.44 for each of you. So that's that $688.88. Okay. If only one of you have it, then it's that $1187.60. Okay, because it's the $344.44 plus the other $800 something for the HMO. Okay, so one of you is on HMO, one of you is on Medicare Advantage. Okay, so let's see here. So that's 344. So again, depending upon your years of service, we would go ahead and subsidize accordingly, and then you know what your out-of-pocket costs are. So if you see right there, the under 10, we don't subsidize, it's 0. 10 to 14, we're subsidizing $298.37 towards it. If you have 15 or more years of service, we're subsidizing the entire $344, leaving the cost to you 0. So if you and your dependent are both Medicare eligible, it is that $688. We would subsidize your premium of the $344, leaving you only $344 for your dependent to have the Senior Advantage. Okay.
Okay. Do you want me to go to the next slide?
Yes, you can go to the next slide.
Okay.
Thank you. Okay, so via benefits and Medicare plans. So plans through the exchange, they're not Acera group plans. These are all individual plans. These will not show up on your monthly retirement statement like your current plan does. So you look on to the right side under where your taxes are, and you can see your medical plan deduction there. You're not going to see a medical plan deduction there if you're going through a plan via benefits. Okay. And you're not going to see the subsidy that we paid towards your premium for that. Plan members who enroll in the via benefits, those are individual plans, you are solely responsible to pay your premium to the carrier that you decide to enroll in. Okay. Once you pay that premium to that carrier reports to via benefits, hey, we received the premium in this amount from this member, this and this and this. Via benefits then verifies the premium amount against the health reimbursement account that Acera has created for you, and they see that you do have funds available, and they turn around and pull money out of the health reimbursement account and reimburse you what you paid for your premium. Okay, so you get reimbursed. The reimbursements can occur either they mail you a hard check, okay, or because if you set up direct deposit, they could direct deposit back your premium of what you paid right back to your account. Okay, so now what can be claimed out of the health reimbursement account with via benefits? Anything that's medical related. So that's your premiums for your plan. It's your co-pays when you go to the office visit. It's your copays when you go to prescriptions at the pharmacy. When you pay for a prescription, you make sure you save your receipt, and you can go ahead and submit the claim to via benefits. And as long as you have a balance there, they'll go ahead and reimburse you back your money. Okay. So they do have auto reimbursement. You can try to set that up with them to where your premium is a set amount, obviously every month for the whole year. So you can set up, depending upon the carrier, some carriers don't have it, but you can go ahead and set up for auto reimbursement. And what that happens is it automatically will reimburse you that premium amount every month throughout the year. Now, things like office copays or prescriptions, okay, there's no telling when you're going to go to an office visit or when you're going to fill out a prescription. So those, when you go to office visit or when you go to a prescription to get a prescription, make sure you keep your receipt that you paid, showing that you paid it. You can submit those to via benefits and get reimbursed for those. You can submit the claim form to them, or you can, what I recommend is you create your login to their website. And there you can view your balance of what you have left as far as what's in your health reimbursement account. And then you can also attach a copy of your claim items as a PDF to it into that login website. And then they can see, oh, okay, this person paid this amount out of pocket. Now that we can go ahead and reimburse them this amount. So there's several ways you can get that done. Okay. Okay. Via benefits enrollment, okay, is done via phone interview. So they don't have an office for you to walk into the visit. So you would do it over the phone. Carriers over there, these are the individual side. So they do require both Medicare Parts A and B. So if you're one of the members that chose not to get Part A because you had they wanted to charge your premium, and you only took Part B, mind you, when you go over to the individual side of the insurance items, they do require A and B. Okay, so most Medicare Advantage plans, they do have Part B built in, so that you want to make sure you confirm it when you're enrolling that, hey, is this offer prescription coverage? Medigap supplement plans are medical only, so you'll need to make sure you enroll into a Part D prescription plan, and the benefit advisors over there, they're quite aware of that, and so they do have a set program to where they go ahead and automatically will get you set up and offer you different plans so that you can select which ones. So you would want to make sure that you have all your prescriptions with you. Okay, that way when you're speaking with them, you can let them know, hey, I take this medication, this medication, this medication, and then they can enter your medications into a prescription profiler, which searches through all the prescription plans, and then it'll show you, okay, this plan here covers your prescriptions, and this is the copay. This other plan covers most of your prescriptions. This is the copay, but this other prescription may be at a higher cost. Here it is. So they'll be able to show, run it through and help you find the best prescription coverage at the best cost that suits your needs. Then you can make that decision of which one to enroll into. Again, a licensed benefit advisor will go over the plans in your area. Okay, plans are nationwide. Okay, reimbursements available for retirees out-of-pocket expenses. Okay, you're not eligible to submit items for your dependent, so it's only for you, the retiree. Okay, again, you can set up auto pay, direct deposit, and reimbursements for the current plan year must be claimed by March 31st of the following year. So, for example, we just finished 2021. So anybody that has been enrolled in via benefits, okay, if they did not submit an out-of-pocket item that they had in 2021, they still have till March 31st of this year to submit for that 2021 item, as long as they still had a balance at the end of the year. Okay, every year the balance amount for the HRA renews. So you have all of calendar year, January through December 31st, to claim your items for that particular year. Okay, come December 31st, if you have a balance in there, it gets wiped out to zero, and January 1st, we start you with the new amount. Okay, but if you still have any claim items for that year, you still have to March 31st to claim things against that balance that you still had at the end of that year. Okay, so you still have some time. Okay, again, online health reimbursement account tracking and status updates. You can go online, log in, and you can view that, okay, boom, they got my claim, it's pending, okay, it's processed and approved, boom, boom. so that you can kind of know where you are. Okay.
Okay, there's one question. For VIA benefits, can you deposit funds into a medical FSA on a regular basis to cover a future charge?
No, we don't deal with FSAs. We have our HRA and that's it. So we already have funds that will be allocated to you as the retired member based on years of service. Okay, and whether or not you're non-Medicare or Medicare, and so you have this balance. So you just matter of you submitting your claims to VIA benefits to draw against that HRA account.
And you can't put extra money in there.
No, you cannot put
Yeah.
extra money.
Okay.
Again, the VIA benefits prescription profiler. Again, the vast majority of members who have gone over to VIA benefits, okay, they're pretty much they're happy with their plans. They stay whatever medical plan they have, they keep. It's the prescription one that I've always advised members to double check with VIA benefits to see if they can get a better prescription plan. Prescription companies, they're constantly creating brand new medications. And when they do that, what the medications that they do have already out there changes tiers, which means it's changing costs. Okay, so and sometimes they go up in price. Sometimes you may have another company, prescription company, that may cover the same medications you got at the same or lower copay at a lower premium. So why not have VIA benefits check the status to see, is there another prescription plan that's going to cost you less for your prescriptions and cost you less in your premiums? And so this is what members tend to do every year. The vast majority of the changes over there are prescription plans, because like I said, some of these prescription companies, they will modify and change and lower certain premiums for certain medications. And then again, other times they'll bump it up. They gotta make some money, so they're going to go ahead and bump up the premiums on you. So that's a good chance for you to go ahead and say, okay, well, they're going to increase, my current one's going to increase my costs. Let me see what else is out there. Okay, here's another one that's going to cost me less on premiums and less on copays. I'll switch over to that one. Okay.
And there's a question. I understand we're supposed to set up a meeting with Sarah 3 to 6 months before we retire, and that is the Ready to Retire counseling session. So will they be able to go over the Medicare options again during that Ready to Retire counseling session?
The counselors are pretty knowledgeable. We've gone through and trained them. If there's any questions that they can't answer at that time, they'll go ahead and reach out to my team or myself, and we'll be able to provide you with additional information.
Great.
All right, open enrollment. Hey, all right. So open enrollment for Sarah, you all know that it's the entire month of November. Okay, Sarah's plan year runs February 1st through January 31st. Okay, so anything you change with the Sarah during the month of November becomes effective February 1st. Okay, now with VIA benefits, their open enrollment occurs from the 15th through December 7th. Okay, and those plans become effective January 1st. They're on a calendar year. Okay, because those are all individual. So theirs is a little bit different. Okay, so you always want to keep that in mind, depending upon where you're trying to go. If you're going to come with us, you're going to go with them. So you got to make sure you keep those dates in mind. And there's still plenty of time, because they overlap. It's pretty good because you're able to get information, because here their open enrollment begins April 15th. Typically, we have our annual open enrollment health fair right around the last week of October. Okay, so you still have plenty of time to, find out about VIA benefits and then watch for our information, because typically by the 15th, we'd have already mailed you your open enrollment packet from Sarah that has that retiree guide and flyers and so forth. And then you're able to say, okay, so this is what the new premiums are going to be for the Sarah plan. So then you can compare, is it lower, higher, whatever it's going to be. And then you can go ahead and make a decision before the end date there and get into a plan that you want to have for the next year. Okay. Again, this is how the subsidies have been going. Okay, so the top bar, where the blue, you can see those are the plans that are non-Medicare, you can see how the amounts 558, then it went to 578. Last year of 2021, it stayed the same at 578. For the current year, okay, for 2022, that amount, the max amount now is 596.73.
Let me put that up on the board.
Okay. All righty. Okay, so there you can see the amounts for 2021 MMA amounts. It was 289 for 2022. It jumped up to 298.37. Okay, for 15 plus, it's 433.99 last year. This year it's 447.55. And a 20-year member, last year was 578.65. Now it's gone up to 596.73. Okay, so we did get an approval by the board for us to increase those amounts that we're granting. Okay.
And do you want to see the Medicare exchange amounts?
Yeah, for the Medicare exchange on the individual Medicare side, okay, you see the amount in 2021 was 221.64. That's now gone up to 228.57. For 15 to 19 is 332.46. That's now gone up to 342.85. For a 20 plus, you remember, from 443.28 is now 457.13. And I know what some of you are thinking is like, how come these are so much lower compared to what the other ones were? And it's because on the individual side through via benefits, individual side period, when it comes to Medicare plans, the premiums are dramatically lower. Okay, so you'd be surprised how much lower the premiums are on an individual Medicare plan. Okay, and just so you know, because we do have to run the stats and provide these information to the board, as you can see, for example, the amounts for the MMAs for the Medicare. A vast majority of members who are Medicare over via benefits do not use up all the money that we put into the HRA. Okay, so basically these are the amounts that we put in basically monthly into the health reimbursement account. Okay, at the end of the year, very few members used up all the money that we placed in there. Okay, to give you an idea, I have a member who, to just that idea how low some of these premiums are. I got a member who's in Georgia, who's in a Kaiser Senior Advantage plan, and she was paying like, it was like $49 for Kaiser Senior Advantage, with a $5 copay for prescriptions and office visits. So you can see at these lower amounts, so on the individual side, you're not going to utilize all these funds thoroughly. Some are in plans like supplement plans that like $132 a month. So the plans on the individual side for Medicare are pretty low. They're much lower than the non-Medicare plan. So you'll save some money there too. Okay.
And there is a question.
Yes.
If you sign up for Senior Advantage, does your enrollment in vision and dental automatically roll over as well?
Okay, so Medicare's impacts only the medical. Okay, the dental and the vision that you have through ACERA is not connected in any way. So those remain intact just as they are. It doesn't matter that you become Medicare eligible.
Great. So do you want to go back to the PowerPoint?
Yeah, we can go back to PowerPoint. Okay, so qualifying events. Okay, so these are the qualifying events that allows you to change plans. Okay, loss of coverage. Okay, relocating out of the service area of your plan. Okay, so if you on vacation somewhere, or you're visiting some family and there's a cute little cottage that you fell in love with, oh, well, let's buy this and move out here so we're close to you guys. Okay, so now you're relocating out of the service area. That's going to allow you to go ahead and change plans. Okay, there's the annual open enrollment. Becoming Medicare eligible, okay, is a qualifying event as well. Retiring after age 65, okay. Marriage, you get married, it's a qualifying event. You're allowed to, add your new dependent on, okay. New domestic partner, you fell in love, your domestic partner needs coverage, complete the domestic partner affidavit, you're allowed to go ahead and add them on. Okay. And in some cases, there's even having a child. You can gotta add the newborn on within 30 days. That's fine. Okay. 30 days is the window for qualifying events.
All right. And then there's a question. If you don't go into medigap right away, do you need to take a medical exam?
Okay, so in regards to pre-existing condition items, that went away. Obama signed off on that stuff back when he was in office, so that pretty much went away. They do want, if you're switching from a Medicare Advantage plan to Medicare Advantage plan, you're fine. Supplement plan to supplement plan, you're fine. If you're going from a Medicare Advantage plan to a supplement plan, there's a good chance that they're not going to look at pre-existing conditions. That's against the law. Okay. But they may send you to underwriting to where you might end up paying just a slightly higher premium, Okay. So that's the thing about switching types of plans back and forth.
Okay. And by supplement plan, you mean medigap plan, right?
Medigap plan. Yeah. Because the medigap plan is considered more enhanced. Okay. And these insurance companies, they're keeping an eye out because, okay, well, this person was on a Medicare Advantage plan. Now, all of a sudden, they want to go to a medigap plan. Okay. There's something going on that all of a sudden now they need to have much better care or coverage or service, so they may put you over to underwriting. So it's easier to jump into whatever with the plan at the beginning, and that's the plan you're going to ride out. But if you go into Medicare Advantage plan and then decide to go to a Medicare medigap plan, you're able to do it. Yes, that's not a problem, but they may put you under as underwriting, where they may charge a little bit of additional premium of some kind. Sometimes the premium stays the same. Sometimes they may bump you up like 10, 15 bucks or something like that, more. And again, you gotta, various plans or various differences. Just like I said, you gotta shop around and come do the comparison.
Great. Next slide. Oh, wait, there's one more question.
Mhm.
What about vice versa? What about if you move from a medigap plan to a Medicare Advantage plan?
You typically that's fine. You could do that. I don't see where they would put you under underwriting to put you into a Medicare Advantage plan, because it's like taking a step, not to put Advantage plans down, but it's like I said, you're going from up here, you're taking a step down to a Medicare Advantage plan. So they might put you through underwriting, but I don't see where they would do that. It's usually when you go from a Medicare Advantage plan up to the medigap plan, supplemental plan, because those are more enhanced and they're more nationwide and so forth.
Great.
Okay. All right. Moving out of the service area. Believe it or not, it happens. It does happen. Don't forget to look into the available health plans prior to moving. I can't tell you how many times members they'll jump the gun and buy a house and move and so. Then later on they say, "Hey, I just wanted to call it. I moved. I got this new place." Da, 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 da. And so then we check and you're out of the service area now. So now you got to change plans and this and that. So when relocating, it is critical that you look into the coverage area of your current plan. Okay. When you're out shopping around, you can always just give us a call. We can let us know what the zip code is of where you're looking at going, and we can take a look and check that out. Mike, the Kaiser zip codes is on this website, right? Is that right?
No, we didn't put those. I mean, the old ones are, but yeah, we didn't put those up yet because I was waiting for the United Healthcare zip codes.
Okay, so there is a way to look up your zip code to see whether or not that zip code is in the service area. If you go to Kaiser website and you search for locations, you're able to type in a zip code and it'll pop up what facilities are in that area. So typically if you find one in that area, then pretty much you should be good to go. So yeah, but you can always reach out to Sarah here, and our team can take a look and see if we make sure that you're okay. So You must complete an Acera address change form to update your record. Only a signed change form will be accepted, no phone calls or emails. Okay, you can always go into our website, and if you have your web member services login, you can go in and do it through the website. It's great. Retirees who reside outside of California may not be required to pay California state taxes. Well, typically you're not. So you want to make sure you complete a state tax form to have us stop taking California state taxes if you're not living in California. Okay, you don't need to be getting those happy letters from from the state, come tax time. Remember to send Acera a completed Acera address change form, name change form, request form, which can be found on our website at www.acera.org/forms. Okay. All right. And, you can always email questions to us at info@acera.org. Okay. Whatever questions you may have, you just email it there. It'll get assigned to a team member, and the team member can respond and give you whatever the answer is and help clarify things. Okay, so we're always ready to help you. And yeah, thank you for viewing. Have a great day. Are there any questions on anything that we've covered today?